My name is Brooke Armistead, and I'm going to perform the physical examination on a feline. This is Ziggy. Her owner is Liz Cook, and she's approved Ziggy for this task. Before I put my hands on Ziggy, I'm going to make sure she's not aggressive or fearful, and she's not going to attack when I open the cage. And she's not. I can hear her purring, and she's rubbing against the fence or the side of the crate, so she's ready to get out. And I'm not afraid of her, so I feel comfortable going through this physical exam. Come on, Ziggy. Ziggy is a domestic shorthair, a calico tabby. She's been spayed. We spayed her here at this clinic. Just looking at her, I can see that she's got something going on with her right eye. So I'll definitely make a note of that. But I'm going to look farther. I'm going to go through all my systems in my physical. We'll start with ophthalmic with her eyes. So I know that she's had this issue for a little bit, and I know that my doctor has seen it before. But I'll still make a note so he can check it again and see if it's progressed in any way. As far as everything else with her eyes, I don't see any intropin or ectropin with her eyelids. I don't see any obvious conjunctivitis. But I will look a little deeper with my instrument here. I'm going to check her pupil's response to light. And even with that scarring or that injury to the right eye, her dilation and constriction is normal when the light is added. So I'll move on to the audit system. I'm going to check her ears. When I check her ears, I'm checking for redness or debris, and I don't see anything like that. But I'll still try to use my tool if she cooperates. I'll still try to use my tool so I can see a little deeper in that ear. What I'll do is I'll extend that pinna up, and I'll put it down her ear just a little bit so I can try to check her tympanic membrane. I'm still looking for redness, swelling, and extra debris. I don't see any in that right ear. I'm going to check this left one. You're such a good kitty. And everything looks normal there. Cleaner than most cat ears. I'm going to move on to the integumentary system. I'm going to check her skin. I'm going to start back here. And I'm looking for redness, scabs, flaky skin, any evidence of external parasites, flea dirt, ticks, anything like that. And I don't see anything like that. I'm going to check around her rectum area. I know, I'm sorry. I'm just looking for the same things. Redness, swelling, irritation, hair loss, anything like that that I could note for the doctor. And I think she seems fine there. I'm going to move on to my nervous system. You can check it several ways. Most often you see this. You just flip their paws, and usually they correct them right away. If they didn't and they left their paw upside down, that would let us know there might be an issue that we could look deeper into. And I've seen her walk some, so I know that she's not dragging anything. There's no head tilt. I'm going to go on to the circulatory system. I'm going to auscultate her heart. I'm going to be listening for arrhythmia. I'm going to feel her pulse for pulse deficit. I didn't hear any abnormalities there. No pulse deficit. There was a pulse for every heartbeat. That heart rate's gonna be right around 144. Now I'm gonna auscultate her lungs, her respiratory system. Okay, I was listening for crackling or any abnormal sounds in her lungs, and I didn't hear anything like that. Everything sounded normal. Okay, so now I need to check my musculoskeletal system. So how I'll do this is I'll just watch her walk, which I've seen her walk previously, and I didn't note any limping or dragging of the limbs, or tenderness or pain in any of the limbs. And so I feel comfortable saying that everything's normal there. Now I'll move on to my digestive tract. What I'm going to do is I'm going to just do a physical palpation of her abdomen area. So I leave my hands flat like this, and I'm going to put them on each side of her abdomen. I'm going to press inward with gentle pressure and just let internal organs just kind of roll through my fingers. I'm feeling for anything enlarged, any abnormal masses, anything abnormal that I could note for the doctor to look deeper into. I don't feel anything like that. Everything is just kind of rolling right where it should be. Everything feels normal there. I also need to check her urinary system, which I'll just look right around her exit area, her vulva area, and I'm looking for discharge or redness or swelling or hair loss where she's been licking it. There would be anything to let me know that she's having a problem there, and she doesn't seem to be having a problem. Everything looks normal there. What I've left to do is I need to check her lymph nodes. So I'm checking for enlarged lymph nodes. They seem to be normal size. They're normal size there. Okay, so overall I would give Ziggy's body condition a 7. Her ribs are pretty difficult to palpate. She does have a lot of extra fluff there, so I would rate her a 7. She is overweight. Hydration is adequate. That falls very quickly. She's not dehydrated at all. She's bright, alert, and responsive. We're going to go ahead and weigh her now. 10.4 pounds. Let me make a note of that. We do need to get a temperature. So if my restrainer will hold her, we're using a mercury thermometer, so it takes about a minute and a half. Okay, girl's egg. I'm also going to watch the rise and fall of her breathing so I can get an accurate respiration rate since we're waiting. Her temp is right at 102, and that's normal, so we're not worried about anything there. I'm going to go ahead and check her mucous membranes before I finish. And they seem bright pink and moist. I'm going to check that capillary refill time. It's less than 2 seconds, so that's normal. I'm just going to look at her teeth quickly. Her teeth are very clean. Not even any staining. No plaque, no tartar buildup. Check her nose. Her airways seem clear. There's no discharge. Everything seems normal there. Overall, I would give her a total body rating of pretty good. I wouldn't say excellent, but I would say good. She is a little overweight. We need to work on that. And that right eye, we need to make sure that's not getting any worse and treat it if possible. And that's my physical on a feline.